breast, colorectal, lung, nasopharyngeal, and liver cancers make up half of the reported cancers in Malaysia. Cancer is now one of the principal causes of death here. By 2023, a total of 16,500 cancer-related deaths were recorded. But what exactly is cancer doing inside the body? Welcome to Gleneagles Healthcast, where we bring you real conversations and expert advice on your health. I'm your host, 𝗖𝗍𝗍𝗿, and today we're going to take you inside the science of cancer, what it is, how it starts, and even what makes it behave differently from other cells. Joining us today is Dr. Fong Chin Heng, an oncologist from Gleneagles Hospital Penang. He will help us understand what happens at the cellular level and why early changes often go unnoticed by a majority of people here. Doctor, thank you so much for joining us.
Thank you, Nisha. Hello, everyone. So I think we are very happy. I'm very happy that we are here today to talk about this topic. Very often people don't realize that they have cancer until it becomes very serious. So it's important that we have this opportunity to talk about screening and even early prevention.
Sounds great, Doctor. That is definitely something that we are looking forward to in today's episode. However, before we begin, a quick reminder that we'll be announcing the winners of our Healthcast quiz at the end of this episode. So stay tuned for that. Also, dear viewers, don't forget to follow and share this episode with someone who might need it. Every bit of awareness actually helps. Dr. Fong, let's start with the basics. What is cancer exactly?
Cancer is a disease that happens when some of our body cells grow in a way that it shouldn't. Normally, our body has a way to control how the cells grow, divide, and die. Healthy cells will obviously stay healthy, whereas abnormal cells will be destroyed by our immune systems. When this system is disrupted, that's when abnormal cells are able to grow, divide without control, and sometimes abnormal cells don't die as they should. Our body sometimes also loses the ability to detect these are abnormal cells, and this causes the cancer cells to stay in our body, and when they start to grow, and sometimes they spread, that causes a lot of problems.
I see. Well, it really does sound quite serious, and there's a lot that's happening in the cellular level.
Yes, it does.
Doctor, actually, can you help us clear something up? So, what we know is tumors are often linked to cancer, but are all tumors actually cancerous?
So that's a good question, Nisha. Now, when we talk about tumor is a non-specific term. It can mean either a benign tumor or a malignant tumor. So the difference between a benign tumor and malignant tumor is basically how these tumors behave differently. So for example, a benign tumor are tumors that grow and form a mass of cells, but they're often able to be treated effectively just by surgery. So if the benign tumors are resected, they often don't come back. And obviously, they don't have the ability to spread to other parts of the body as well. So these are known as benign tumors. Whereas malignant tumors, on the other hand, have this ability to recur and also the ability to spread to other parts of the body. So sometimes even after surgical resection, malignant tumors can still come back and sometimes spread to other parts of the body. So these are known as cancer cells or malignant tumors.
I see. I guess the type of tumors that we should be looking into when it comes to cancer are malignant tumors.
That's right.
Where benign tumors are localized.
Yeah, and can be treated very easily with surgery.
I see. I think that sounds quite fascinating, actually. So tell us, doctor, what actually causes these cells to behave in a certain way?
So that's also a very good question, because then we have to talk about what makes a cancer cell cancerous. So obviously, when the tumor cells mutate and become cancer cells, they acquire a few ability that is otherwise not present in normal cells. One thing, they are able to grow uncontrollably, divide uncontrollably. They're also able to invade into the normal tissues. So these are obviously not abilities that are present in normal cells. Cancerous cells are also able to invade into the blood vessels or to the lymphatic system, and that's when they begin to spread to other parts of the body. For example, the lymphatic nodes via the bloodstream to other organs like our lungs and liver. So that's what makes it dangerous.
I see. I think that is really something that we need to look into as well. How does this uncontrolled growth effect actually affects the rest of the body?
Right, Nisha. So when we talk about cancer cells, there are two terms that are important to know. The first is called the primary. Primary, it means where the cancer cells begin. So for example, if you have a lung cancer or a breast cancer, the primary site is the lung for lung cancer, and for breast cancer, the primary site is the breast. But when cancer metastasizes, that's when the cancer cells spread to other parts of the body, and it can be anywhere, like the brain, or lungs, bone, liver, anywhere. And that's when the cancer cells begin to invade and destroy the organs where they reside. That's what causes all the problems to patients where cancer has begun to spread. And in those cases, we also call or stage this cancer as stage 4 cancer.
Oh, it actually sounds quite serious. Knowing that it's such a complex process, is there anything that we can do about it?
Yes, that's a very important question, Lisha. If you remember what I spoke to you about the primary and secondary, right? We have the cancer that remains at the primary site. These are known as early stage cancer. Whereas when cancer spreads to the secondary site, that is metastatic or stage 4 or advanced cancer. So in order to treat cancer effectively, we must be able to detect cancer at an early stage. So this is when prevention comes in, screening, and also early detection, which is going to talk about a bit more later, I think.
I believe so. I think prevention, early screening is very important for patients before it continues to divide in the body.
So that we can detect cancer at an early stage and thereby able to give patients more effective treatment in order to give patients a higher chance to achieve cure.
Let's go a little deeper into the topic. We actually like to know, how does a normal cell actually turn into a cancer cell?
Thank you for the question, Nisha. So now we talk about this a little bit just now. I can sort of explain a bit more about how normal cells turn into cancer. If you remember, we spoke about cancer being a product of genetic mutation. So the question now is, how does this mutation occur in normal cells? Very often, the normal cells get damaged when they're exposed to something we call carcinogens. So carcinogens are things like tobacco, smoke, some heavy chemicals, heavy metals, and it can also be caused by infections, certain infections, bacterial or viral infection. So when normal cells are exposed to all these agents causes essentially damages in the DNA. So when these DNA that controls cell growth, cell division, that controls how cell die in a natural way, when all these processes are being affected by the damage, that's when the normal cells turn into cancer cells. So essentially, all this sort of boils down to exposure to carcinogens. So one of the way, obviously, to reduce the risk of developing cancer is to avoid carcinogens.
I see. Well, it sounds like it does quite a lot of damage to the body itself. But is there a way for our body to actually protect itself?
Yeah. In a normal situation, our body has the ability to repair these damages. But sometimes these damages are not repaired because the repair mechanism is affected by also DNA damages, or sometimes the body does not have the ability to repair these damages as well when there are some inheritable inherent genetic mutation within the cell. Another important point to note is the ability of our immune systems to detect these abnormal cells and destroy them. Sometimes cancer cells acquire the ability to avoid detection by our immune system. So when they have this ability, our body loses the ability to sort of detect and destroy these abnormal cells. So that's why one of the treatment for cancer cells is to sort of stimulate our body's ability to defend ourselves using our own immune system. That's known as immune therapy. But that's also another different discussion already.
I think we'll dive deeper into the topic later. Thank you so much for sharing, Doctor. From what I know, treating late-stage cancer can be painful to patients actually. So, can the painful treatment be avoided if the cancer is detected early?
Definitely, Nisha. So, if cancer is detected late, especially when cancer has metastasized, not only is the cancer treatment laborious, painful, it is also very costly. And furthermore, treatment for late-stage cancer tends to be long-term, which then also not only affect the patient, but also affect the patient's family, friends, a very wide-ranging effect on the patient's surrounding and people who cares about the cancer patients itself. So that's why it is important to detect cancer early, because if cancer is detected early, the cancer can be treated effectively, more effectively, and many patients can actually be cured with effective treatment, and thereby avoiding late-stage cancer treatment, it comes with a lot of side effects and costs and so on.
So I guess we can see prevention is definitely better than cure.
Yeah.
Now, many people wonder, how can they tell if something might be wrong with them? Or are there any signs or symptoms that they should watch out for when it comes to cancer?
Yes, that is an important question, Nisha. So, all of us need to be very aware about the normal function, the normal status of our body when we are at our healthiest, because that allows us to detect early changes that happens in our body. So what are the common early changes that happens in common cancers? Now, a few things that you have to remember, right? The common cancers that we often face are, for example, like breast cancer, lung cancer, GI cancer, prostate cancer, cervical cancer, or genitourinary tract cancer. So the symptoms depends on where the primary tumor begins. For example, if the breast cancer, the patient may detect a breast lump. If the lump is persistent, then it sort of the patient will have to get early examination or investigation soon. If a patient has persistent weight loss, loss of appetite, or if there's altered bowel habits, bleeding when the patient passes motion, if there's altered urinary symptoms, if there's bleeding, abnormal menses, all these are potential symptoms that points towards potential serious problems. So when patients are aware about these symptoms, then the patient is able to seek help, seek investigation or examination, and able to detect the cancer early. So that is what is known as early detection. But also importantly, before a patient has symptoms, we have such a thing called screening. Screening is when we try to look for potential problems even before patients have symptoms. For example, it is recommended for women at a certain age to go for mammogram. So that's an effective way to screen for breast cancer, even before there's a detectable breast lump, right? So we talk about early detection and screening in order to detect cancer early.
I guess this too is very key in order for us to detect the cancer.
That's right.
You mentioned that some cancers can actually be prevented. Can you explain more about that?
Thank you, Nisha. So we spoke about carcinogens as the cause of causing cellular damage and leading to cancer. So obviously one of the ways to prevent cancer is to avoid the carcinogens. Now we know that we are born with our genes. We can't choose our genes, but we can choose to avoid carcinogens that potentially can cause harm to our body.
I see. Well, is there a way that we can prevent that? Is there any specific example?
Yes. One of the most important carcinogen that causes a lot of problems, especially as a main cause of lung cancer, is the tobacco smoke. If one is a heavy smoker, it is widely known and reported that if tobacco smoke is a carcinogen, then can cause the development of cancer, various types of cancer in the lung. But not only that, for a passive smoker, someone who is not smoking but lives around people who smoke, as a second-hand smoker, that also increases the risk of the patient or the person developing lung cancer, even though they are not active smoker. The other example is alcohol. We know that alcohol is also an important carcinogen that can cause many types of cancer, namely liver cancer, colorectal cancer, breast cancer, esophageal cancer. So what happens is that the alcohol, being a carcinogen, causes damage to the cells. In the liver, it causes liver cirrhosis, and that in turn leads to various cancer in the liver in various parts of the sites that I mentioned just now. So to avoid or to prevent tobacco, to avoid and to refrain from taking alcohol is a very effective way to prevent cancer.
Apart from smoking and drinking, is there anything else that we can do to prevent cancer?
Absolutely, Nisha. So being overweight and having an inactive lifestyle increases cancer risk. So having active physical activities, trying to lose your weight, then in turn helps to prevent cancer. And on top of that, we also know that diet helps. Try to avoid processed food that contains chemicals like preservatives, coloring, burnt, charred food, red meat are also known to cause cancer. So we try to avoid that by taking more fresh, natural food, vegetables, fresh foods, fruits, fibers. So all these are healthy foods that should be taken more often.
I see. So I can say that weight maintenance and also a healthy lifestyle actually helps to prevent cancer.
Yes.
I see. Well, I know I've asked a lot of examples already, but doctor, do you happen to have any other example? I know I've heard of UV radiation. Does it prevent cancer?
Absolutely. Now, the ultraviolet rays are also known to be able to damage our cells, especially if you are exposed to UV radiation long term for many, many years. Our skin tends to get damaged, and that gives us the risk of developing skin cancer. So yes, avoiding UV is another way to prevent cancer. So how do we do that? We try to put sunscreen, apply sunblock, or try to avoid being outdoor for a long period of time. And other than that, also, Nisha, we have effective vaccination that prevent cancers that can be caused by certain infections. For example, the hepatitis B vaccination, human papillomavirus, HPV vaccination. These are all important vaccination programs that can reduce the risk of cancer developing from bacterial or viral infections.
I see. All right. I hope you've heard that. Don't forget your sunscreen when you go out of your house. And also vaccination is also key. Now let's dive down into the topic. Doctor, I'd like to ask more. You know that cancer is well known to everyone and it's a growing issue nowadays.
Yes.
Is there any research that goes on within the cancer?
Yes. It is quite an exciting time for the oncology field these past few years, because so many things are being discovered about our understanding for cancer and also how we treat cancer. Now, I am also involved in some cancer research, And sometimes I'm really amazed by how new drugs are able to so effectively treat cancer, even though they are stage 4, metastatic and advanced cancer. But new treatments are able to provide very good cancer control with very little side effects. So a little bit more about cancer research, because I think it is an exciting thing to share with everyone, is that we have so many new discoveries now, new targets, molecular targets that can be treated using new advanced targeted therapy. We have drugs that stimulate our own immune systems to fight cancer. So all these new drugs, new treatment are able to provide a more effective treatment with much less side effects, an easier way to administer all these advanced new drugs to our patients.
I see. That actually sounds quite advanced in the research field of cancer. Well, I'm afraid we've talked a lot about cancer and we've come to nearly the end of our episode. Would you like to add anything else, Doctor?
Yes, so I guess for the past few minutes away, we have talked about a few things. We talk about how cancer cells develop in our body. We talk about early detection when you have symptoms. We talk about also screening, where you go to get investigation done even before you develop symptoms. So early detection and screening helps us detect cancer early before they develop into advanced stage, and thereby help us to get more effective and curative treatment. And finally, we also talk about prevention, right? How to avoid carcinogens, how to live a healthy lifestyle, how to avoid ultraviolet rays, how to get vaccination so that you can prevent the development of cancer right from the beginning. So I think all these are important points to remember from today's session.
Definitely. And it can definitely benefit all of us, as yet again, I'll emphasize prevention is better than cure.
Yes, I agree. I cannot agree more.
Well, I think we have come to the end of our show. Thank you for the insightful responses, Doctor. I think we've really learned a lot today on the importance of early detection, as well as ways to prevent cancer cells from developing. Thank you for coming.
Thank you for having me here. You have given me an opportunity to share an important message with our audience, and I'm very happy to be part of it.
Thank you for coming here, Doctor. And as promised, here are the winners from last week's giveaway prize. If your name appears on the screen, please send us a direct message to claim your prize. Thank you to everyone who took part, and do try again next time. Thank you for staying with us as well today. If you have any questions, feel free to leave a comment below. Don't forget to like this video and follow us for more health tips. We'll see you in the next episode. Bye everyone!